And we have Dr. Shruti Sonni, who is Chief of Neurology with us today. And we're going to talk about a very important subject. And we want to also welcome Saludos Vida, which is our Spanish community, which joins us live via Facebook. So welcome, Dr. Sonni. Thank you so much for coming on board and sharing all of this information. It's very important. So welcome.
Thank you so much for that introduction, Roberta. And thank you all of you for joining me today to learn about this important topic. Roberta reminded me that May is Stroke Awareness Month. And so this is a very good opportunity to just share some basic information about stroke. This talk will be focused on primary prevention of stroke. So what steps can we take to prevent having a stroke in the first place?
I just also wanted to say, if you folks have any questions, please put them in the chat and then I can get them to the doctor. So just put your questions in the chat and please mute.
Okay, very good. So, this is just the introduction slide. Our topic today is stroke prevention. My name is Shruti Sonni. I'm fellowship trained in stroke neurology. I completed my fellowship several years ago and have been practicing as a general neurologist here at Cambridge Health Alliance. And I have a special interest in the field of stroke. Lexi, could you advance to the next slide, please? Thank you. So what is a stroke? I'll go into this, but stroke actually is an umbrella term used for two different processes that happen in the brain. When we commonly use the word stroke, we're actually referring to an ischemic stroke, which occurs when blood supply to a part of the brain is interrupted or reduced. And then when you don't have blood supply to a part of the brain, the brain tissue does not get oxygen and essential nutrients. And brain cells are very sensitive to lack of oxygen and can begin to die in a matter of minutes. So here's a little bit of a diagram just to show how a clot can obstruct blood flow or blood supply going to a part of the brain. This is actually different from the heart. So much of the pathophysiology or the disease mechanism in cardiovascular or heart disease is similar to that in stroke, which is also called cerebrovascular disease. The difference is that heart muscle can actually the tissues can live without oxygen for longer than brain tissue can. So the brain cells begin to die very quickly without lack of blood supply, oxygen and nutrients. Next slide, please. While we're waiting for the next slide, I can just, start speaking about the two types of stroke that I mentioned. So the first is ischemic stroke, where there's lack of blood supply to the brain. And the second type is hemorrhagic stroke, which is also known as intracranial. This is actually when a small blood vessel ruptures and blood actually fills the brain, not the entire brain cavity. Here you can see a picture of the two types of stroke. So I was saying that, on the left, you can see an example of an ischemic stroke where there's lack of oxygen, also called anoxia. So there are two terms we use, ischemia and anoxia, and hypoperfusion, meaning less blood supply. So those are the factors that lead to an ischemic stroke. And on the right, you have a picture of a blood vessel rupturing and blood leaking into the brain tissue. And this is a hemorrhagic stroke. So, sometimes we'll hear that somebody, a friend or family member has suffered a stroke. It's important to try to understand which type of stroke they've had. Did they have an intracranial hemorrhage or did they have an ischemic stroke? The next slide, please. This is an MRI image of an ischemic stroke. The bright region that you see is an area of dead tissue, essentially, which is a result of lack of oxygen and blood supply. MRIs are very sensitive at detecting strokes very early in the course. MRIs have advanced so much that we think that lack of oxygen and the damage to the tissue can be detected within minutes, maybe 15 minutes to a half hour. Anything longer than that, the brain will actually show evidence of damage from loss of blood supply. Next slide, please. Here we have a picture of an intracranial hemorrhage or a hemorrhagic stroke. This image is a CAT scan, also known as a head CT. This head CT is done without contrast, and the bright, hyperdense focus that you see in the center of the brain is leaking blood from one of the ruptured blood vessels. Intracranial hemorrhage commonly occurs because of uncontrolled high blood pressure. There are other factors also that can lead to intracranial hemorrhage, but someone who has a hemorrhage in their brain that looks like this most likely is from uncontrolled high blood pressure. Next slide, please. Okay, so here are some sobering facts about stroke. Approximately 795,000 people in the United States have a stroke each year. Stroke is the fourth leading cause of death in the US. It is a leading cause of functional impairment, meaning where people, unfortunately don't die, but are left with significant functional problems where they're unable to live their regular lives. It changes the lives not only of those who experience a stroke, but also of the family and other caregivers. And a major stroke is viewed by more than half of the stroke victims. More than half of those at risk as being worse than death. Primary prevention is particularly important because 76% of strokes are first events. So by that, I mean someone can have a stroke and could have, suffer a stroke a few years down the line. But if you look at all stroke events that are occurring, 76% of them are first-time strokes. So this is why I wanted to focus today's talk on what can we do to protect ourselves, and how can we educate ourselves and our loved ones on risk factors of stroke and how we can work on those risk factors. Next slide, please. So how do you detect a stroke? You may have seen this acronym FAST, F-A-S-T, in public places such as the train or a bus. This has been used, the FAST acronym has been used for many, many years. And it essentially refers to F being a facial droop or a sudden asymmetry in the face, A being an arm, or honestly a leg as well, like any extremity suddenly drooping down or falling down with weakness. S refers to changes in someone's speech. So speech is a little bit more complex because a person can lose the ability to find words or understand words, and that's a language impairment that can happen with a stroke. Or they could have trouble with the mechanical production of speech, what we call garbled speech or slurred speech. So any sudden change in someone's speech pattern or language pattern. And then the T refers to time, essentially, referring to how sensitive brain tissue is to loss of oxygen and how we must call 911 immediately and not really wait for things to get better, because time is brain. Next slide, please. In recent years, this acronym has been extended to be called B-FAST, And the B stands for balance, so loss of balance or sudden onset of dizziness. And then E refers to any loss of vision, change in vision, like losing one side of your vision, having sudden onset of double vision. These should be red flag signs for someone to think of a stroke as being the cause of the symptoms. Next slide, please. So now I'm focusing, all of the material in this presentation is from the American Heart Association, American Stroke Association, and these are the most recent guidelines for the primary prevention of stroke. Next slide, please. So there are certain non-modifiable risk factors for stroke. So essentially, these are things we're born with that we cannot change. After this, I'll focus on the modifiable risk factors. I always tell my patients, we can't really do much about the cards that we're dealt with, but we can, do our best to minimize those risk factors that we're born with. So age. As we advance in age, our risk of both ischemic strokes and hemorrhagic strokes increase. The second is low birth weight. So low birth weight has actually been associated with an increased risk of stroke later in life. Ethnicity. Black and some Hispanic and Latino Americans have a higher incidence of stroke, especially compared to whites. And this is particularly true for young and middle-aged Blacks who have a substantially higher risk of subarachnoid hemorrhage. This is something I hadn't mentioned before, but it's when an aneurysm ruptures in the brain and blood can leak in the brain, as well as intracranial hemorrhage. So even younger people of these ethnicities are at risk for these events. And then genetics. So just having a positive family history of stroke increases the risk of stroke by about 30%. Next slide, please. So these are the modifiable risk factors, things that we can do something about. So physical inactivity, dyslipidemia, which is a disease of lipids or high cholesterol, diet and nutrition, hypertension or high blood pressure, obesity, diabetes, cigarette smoking, atrial fibrillation, which is an irregular heart rhythm, other cardiac conditions such as, having had a heart attack or cardiomyopathy where the heart doesn't pump as well, valve disease, PFO, which is a hole in the heart, which is actually very prevalent in the population, sometimes doesn't cause problems, but this could become relevant if someone has a stroke, cardiac tumors, which are quite rare, and atherosclerosis, which is a buildup of plaque within the aorta, which is one of the main blood vessels that comes out of our heart. Carotid stenosis, which is the carotid artery. There are two of them, and they're some of the main blood vessels that supply the brain coming out of the aorta from the heart. And then sickle cell disease. Next slide, please. So the American Heart Association has defined life's simple 7, which are 7 risk factors that people can improve through lifestyle changes to help achieve ideal cardiovascular health. So the first is you can manage your blood pressure. Second, control your cholesterol. Third, reduce blood sugar. Fourth, get active. 5, eat better. 6, lose weight. And 7, stop smoking. So the rest of my talk is really going to dig deep into these 7 modifiable risk factors. So things that we can actually do to reduce our stroke risk. Next slide, please. So the first I'm going to focus on is managing high blood pressure. I apologize if I'm just glancing away from this camera because I have another screen where it's much larger. So high blood pressure is a major risk factor for heart disease and stroke. And many of these things, the Life Simple 7, it's an approach to prevent heart problems like heart attacks, myocardial infarctions, as well as stroke, because it's a shared risk factors. So when your blood pressure stays within healthy ranges, you reduce the strain on your heart, arteries, and kidneys, which keep you healthy longer. So this infograph on the right side of the slide is available on American Heart Association. It's heart.org, and you can actually access these slides because these are really simply put and very educational on what is high blood pressure. What do the numbers mean that your doctor or provider, healthcare provider are telling you? So for instance, when you measure your blood pressure, you get two numbers. The upper number is called the systolic blood pressure, and the lower number is the diastolic blood pressure. So the systolic blood pressure measures the pressure in your arteries when your heart beats. So when your heart is contracting, what is the pressure in your blood vessels? And then your diastolic blood pressure actually measures the pressure in the arteries when the heart is relaxing. So some of these risk factors can make your blood vessels brittle and hard and not allow them to expand and relax the way they should. So that's the meaning of these two numbers. And typically we like to see numbers, the higher number being around 120 and the lower number being around 80. Anything more than this is considered high blood pressure when people have sustained readings in that level. So what can you do to manage blood pressure? You can frequently check your blood pressure if you're at risk for high blood pressure. You can change your lifestyle. So the gray table on the right side has measures that you can do to change your diet, lifestyle. And then you can control your blood pressure with medications. So the 5 main points for success in controlling your blood pressure. The first is eat smart. I'm going to go into like what eat smart actually means because this is a common trend in the rest of my talk. So eat smart means including a healthy diet of vegetables, fruits, whole grains, beans, legumes, plant-based protein, and lean animal protein, as well, such as like fish. And these are things that you should be eating. The things that you should limit are sugary foods, sodium, saturated fatty acids, added sugars. And then also you should try to limit sugary drinks, fatty and processed meats, salty foods, refined carbohydrates, and highly processed foods. So we'll touch upon this again in when we come to eating a healthy diet. This is so important because I'm sure many of you have heard from various healthcare providers, eat healthy. But what does that really mean? I think this is just excellent information for all of us to really, have a general umbrella of what we should be eating, what we should be limiting, and what we should be avoiding. So going to the next point is move more, manage weight, don't smoke, and sleep well. So the other things also will be touched upon in later slides. If you could go to the next slide, please, Lexi. Thank you. So the second thing we can do is control our cholesterol. High cholesterol contributes to plaque. So plaque is a buildup of essentially unhealthy fats, things like blood products, platelets, etc., which create a narrowing of blood vessels and eventually can clog arteries, lead to heart disease and stroke. So this is the main thing that's happening in our blood vessels that leads to heart disease and stroke. So when you control your cholesterol, you're giving your arteries their best chance to remain clear of blockages. So you may have heard of different types of cholesterol. There is total cholesterol, HDL cholesterol, which is considered a good cholesterol. We want that level to be high. LDL cholesterol, also called bad cholesterol, we want to try to make that type of cholesterol lower in our blood, and triglycerides. So tips for success here, very similar to previously: eat smart, move more, know your fats. So know what good cholesterol is that you can enjoy and eat in moderation, and then know the bad fats, which are essentially saturated fatty acids, your cheese, butter, certain types of oil or oily, greasy foods, fried food, things like that. And then don't smoke, and take your medications as directed. So here, what you can do in conjunction with your healthcare provider is get annual blood work, find out where your cholesterol is. And then if needed, after these lifestyle and diet changes, if needed, you may be prescribed a medication known as statins to reduce your cholesterol. The truth is, there's a lot of information and misinformation out there about statins. I wouldn't call myself a lipid specialist by any means, but I will suffice to say that a lot of stroke trials truly show that taking statins, especially after having had a stroke or a similar event, reduce your risk of subsequent strokes, and they also reduce mortality in patients with heart disease and stroke. So that's quite compelling to me as a physician and a prescriber, to really advocate that my patients take statins quite seriously. Next slide, please. So the next thing you can do is reduce your blood sugar. So I'm just going to give you like a very, very brief overview of what diabetes is. Many of the foods that we eat, which are good for us, that give us energy, have carbohydrates, which break down into sugars in our body. Our pancreas produce an enzyme called insulin, which processes these sugars. But if someone has diabetes, they have a resistance to this insulin. So the insulin doesn't work as well. And then eventually the pancreas don't produce as much insulin, leading to increase in blood sugar in our blood. So when you have increase in blood sugar over time, these high levels can damage our heart, kidneys, eyes, nerves. And if anyone is familiar with diabetes at all, we know how it can really, affect someone's health and life in many, many ways. So what can we do? Tips for success. Again, going back to the eating smart, move more, manage weight, and don't smoke, because smoking actually makes the treatment of prediabetes and diabetes more challenging. Next slide, please. So now let's get specific about what getting active means. Living an active life is one of the most rewarding gifts you can give yourself and those you love. So simply put, daily physical activity increases your length and quality of life. So how do we become more active? The American Heart Association recommends 150 minutes of moderate aerobic activity in a week, or 75 minutes of more vigorous or intense aerobic activity. And when we say, exercise, we're focusing on building your muscle strength, which is very important as we grow older, to maintain our posture, to prevent falls, things like that. And then as far as your heart, you want to add intensity to your exercises. So if all these years you've been, taking like a little stroll, you could pick up your intensity by perhaps brief periods of brisk walking. And then sit less. So this is something that we've all fallen a trap to, especially during COVID and working from home. We're sitting for most of the day. And that's really not very healthy for us. So we should remind ourselves, some of us have fitness trackers that'll remind us to stand up and move, or, finding friends or family to motivate you to really get up and move. Just sitting for a long period of time is not healthy for us. So what are tips for success? It's good to set realistic goals about how you're going to get active. Once you reach these goals, perhaps it's, I want to walk 5 days of the week for 30 minutes. Once you reach those goals, keep going, like, continue, be consistent with your exercise and activity, but also, set a slightly higher goal. Walk more. I know that mobility is something that we sometimes take for granted. And unfortunately, many of my patients have mobility issues due to age or other neurological issues. But if you're able to walk, I think it's, especially the springtime in New England, it's just such a pleasure and a privilege to be able to walk. So if we can walk, we should find opportunities to walk more, and then add it up. So, find ways to, just find opportunities for breaks. Sometimes if I have like a 15-minute break, and this is something, it's a personal goal that I'm working on as well, to walk more, I'll step out for a brief 10-minute walk. It doesn't have to be a long 1-mile walk. Just moving is really good for us. And then make things a habit. Next slide, please. So eat better. And I went into this a little bit in the beginning because, again, this is something that we can all learn from. And it's something that's always easier said than done. Many of my patients are older and they sort of feel like, what's the point of living if you don't get to enjoy all of the things that you like to eat? And I must say they do have a point there. But having information, in the back of your mind when you're making those food choices is always good, because there are things that you can enjoy. You can enjoy as many vegetables as you want. Fruits, for the most part, if you're not diabetic, you can enjoy fruits instead of those processed sugars, whole grains, beans, legumes, nuts, plant-based protein, lean animal protein, skinless poultry, fish, all of these things you can enjoy. What you should limit are sweetened drinks, sodium, processed meats, refined carbohydrates like added sugar, processed grains, full fat dairy products, eggs. This whole full fat dairy and eggs is very controversial, but American Heart Association has it over there, so I'm sharing with you. Highly processed foods, some oils like coconut and palm oil, these are things that you should limit. And then what you should really avoid are trans fat and partially hydrogenated oils, which are found in commercially baked goods and fried foods. So these are things, that that you really shouldn't be eating. And so if you're indulging in fried foods a lot, at the back of your mind, your conscience knows that you're not doing something perhaps which is the best choice for your body in the long term. So it's a good habit to start reading nutritional labels now that we know this information. And some other tips for success in eating better are watch your calories. So, I wouldn't necessarily say track your calories forever and be extremely restrictive, but it's actually a good habit sometimes for a short period to track your calories and actually understand in reality. You might feel like, I think I eat well for the most part, but when you actually write down those calories, you'll actually realize and understand what you're consuming on a daily basis. Try to cook at home as much as possible. Look for the heart check on labels of foods, and then learn the salty six. So, essentially all the good stuff that we like to indulge in: breads and rolls, pizza, sandwiches, cold cuts and cured meats, soups, burritos and tacos. These things are indulgences we can allow ourselves once in a while, but when it becomes a lifestyle, that's when it becomes a problem. Next slide, please. So, this segues into lose weight. So when you shed extra fat and unnecessary pounds, you reduce the burden on your heart, lungs, blood vessels, and your skeletal system. And you give yourself the gift of active living, you lower your blood pressure, and it helps you to feel better too. So weight loss, I know it's an oversimplification because many of us have had, struggles with our weight and or something that you're always working on. At the end of the day, it's calories in versus calories out. So we spoke about how we can choose our calories better to be healthier foods. And then calories out goes back to being active and exercising. So tips for success: control your portions. If you sit down and actually log all of your calories and portions, then you'll understand how much you're eating, and then you could control them if needed. We want to get active, as we spoke, eat smart. And then if you're not able to lose weight after trying all of these measures, get help. Speak to your provider about these things. Next slide, please. So finally, stop smoking. So cigarette smokers have a higher risk of developing cardiovascular disease. And if you smoke, quitting is the best thing you can do for your health. And, so educate yourself about the harms of smoking. And when you are convinced, make a plan to quit. So these are the steps that you can take. You can set a date. You can choose a method. Are you going to be quitting cold turkey or trying to cut it down gradually? You can decide if you need a prescription or help from your healthcare provider, such as nicotine replacement or other medicines to cut cravings. Prepare yourself for how you're going to deal with the cravings, deal with the urges after you stop smoking, and then finally quit on the day that you've set a goal for yourself. So, tips for success: learn, how to deal with urges, get active, find different ways to deal with your stress, get support, and then finally stick with it. The last slide is just a thank you slide, and I am happy to answer any questions you may have. Thank you so much for listening.
Thank you, Dr. Sonni. We don't have any questions in the chat. You've done your job very well and explained everything. It all goes back, and I always say, food was our first medicine. It always goes back to diet. We're getting some kudos. Oh, we have a question. What is your question? Is there a genetic test to determine risk?
So there are certain risk factors for a hypercoagulable state, meaning a risk for clotting. That could be, genetic, and also you can check for in blood tests. As far as like an easy marker to detect someone's risk of stroke, I'm not aware of any genetic test, which I'm sure people are doing research on. But then all of these risk factors, if you do have a risk factor for them, there are screening guidelines and parameters, when we should really start checking our cholesterol annually as part of like our annual labs. And really, I would focus on preventative health care, really, seeing your primary care physician annually, getting that. Many people, who deal with weight issues are afraid to get on that scale, and they're afraid to hear that BMI number that's thrown at them because they feel like they're being objectified, like, I'm not just this number. But really try to find an empathetic healthcare provider who can help you deal with these goals. And then to more directly address your question, get those labs done. So those will really be signs of risk for stroke.
Thank you. Another question: how would you define aneurysm? Is it like a hemorrhage stroke?
Great question. So an intracranial aneurysm or a cerebral aneurysm is an outpouching of a blood vessel. So if you can imagine like a little bubble that forms on a blood vessel because of weakness of the blood vessel, weakness of the artery. So if this is a high pressure artery, that aneurysm is at risk of rupturing or bursting and leaking blood into the brain. This leaking of when an aneurysm ruptures and there's leaking into the brain tissue, it's called subarachnoid hemorrhage. So the subarachnoid is just the space that the blood vessel is in where blood can collect. And you may have heard of the phrase thunderclap headache or worst headache of your life. That is a major red flag, which, if you have migraines and then you have another bad migraine, that's one thing. But if you don't typically get headaches and you get the worst headache of your life, that is a sure sign that you should call 911 and be evaluated immediately. So, doctors can order a test to look at the blood vessels, and that would show the aneurysm, which is like a small outpouching or a large outpouching in some people, which needs to be treated emergently.
And just Cambridge Health Alliance, do we have some programs? We have the mindfulness program, other programs to help us modify our lifestyle?
Yes, certainly mindfulness. And then we have nutritionists, when just speaking to your healthcare provider doesn't quite cut it and someone's really dealing with a particular issue, you could always ask your provider for a nutrition consult to learn more about how to eat. And then, also, I'm not sure if we offer our patients any sort of like exercise programs, but really just getting active in any form.
Thank you. And I just had one other question. For older adults, is the blood pressure the same, like the target number the same, the 120 over the 80? Is it the same, or do when folks start aging, does that number change at all?
Excellent question, Roberta. So we have some patients who have had high blood pressures for many years. And so, when they get admitted, it's important to know their baseline blood pressure with the best of medications. We would still like to aim for a goal of 120 over 80, but some people have had changes already to their arteries where that number isn't easy to achieve. And actually suddenly dropping their blood pressure to that number may not be the safest thing because 120 by 80 might be too low for them. But these are patients that we call brittle hypertensive. So this is the exception rather than the norm. We still want to aim for a blood pressure of 120 over 80.
Thank you. And always, to see any specialist, we have to go through our PCP, our primary healthcare provider, because they are the navigator through the entire healthcare system. And that's how they would get to you or any other specialist at CHA. And CHA does offer some free yoga classes. And if you can go on challiance.org and search for wellness programs, you can find some programs there to help. Well, thank you so much, Dr. Sonni. This has been very informative, and I'm sure, and everyone is giving you kudos, and thank you so much for taking the time and sharing this important information with the community.
You're very welcome. Thank you so much for attending and listening and learning and sharing, more importantly.
Thank you. And for anyone that doesn't know me, I'm Roberta Robinson, and I work marketing manager at Geriatrics. So we have, let's see, we just have, thank you. So thank you so much. Everyone, we'll see you next month and on the first Wednesday of the month. And we have Dr. Luann Bruno Murtha. She's coming on board. She's the chief of infectious disease. And we're going to talk about that booster. We're never tired of talking about the boosters. So hopefully we'll see you next month. Thank you so much, everyone. Take good care.